External cephalic version is an obstetric procedure in which a fetus that is lying breech, that is the buttocks at the pelvis, or a child that is lying transversely, is meant or manipulated to lie in cephalic presentation prior to the onset of labor, such that a vaginal delivery is possible. It is usually done around 36 weeks or at term in the labor ward that has facilities for an emergency cesarean section. In the preparatory step, the patient is usually cancelled on the indication for the ECV, the complications, the contraindications, and if there is going to be an intervention after the procedure. Usually a bedside ultrasound scan is needed so as to help see or assess the fetal position, amniotic level, placenta localization. It also helps us determine the likelihood of success. A fetal biophysical profile and a non-stress test is usually done so as to know the fetal well-being. A written informed consent is gotten from the patient. A chaperone must be present. A tocolytic agent may be given to the patient in order to quieten the uterus. Epidural may be needed so as to prevent pain or make the patient feel comfortable. Now, we have to ensure that all the contraindications to vaginal delivery are ruled out. In the steps, the patient is placed in supine position, exposing the abdomen from the underneath her breasts to at least the pubic hairline. Then she's relaxed, and then we ensure that she's comfortable. The fetal heart rate is taken using a PNAD or Sonicade or an ultrasound scan. Now, an ultrasound gel is applied, or a talc powder is applied on the maternal abdomen to allow the examiner's hand to move freely. When the uterus is relaxed, the breech is elevated out of the maternal uterus. When that is done, with one hand on the breech and the other hand on the fetal head, the breech is elevated out of the maternal pelvis and a forward roll is attempted. If a forward roll is not as successful, attempt a backward roll. The fetal heart rate is taken every 1 to 2 minutes in between the procedures. This is to ensure that there is no fetal distress. Once there is fetal distress, stop the procedure or abandon the procedure. Stop the procedure if there is any maternal discomfort or the patient does not tolerate it. If you have made 3 to 4 attempts, discontinue the procedure if you are not successful. But if you are successful, then monitor the patient in the labor ward to ensure stable fetal maternal vital signs. Document the procedure and the number of attempts that was made before it was successful. Give the patient instruction on the danger signs such as bleeding per vagina, rupture of membrane, labor starting, abdominal pain, or if there is any suspicion of fetal distress, so that the patient will present to the clinic or to the labor ward. In conclusion, external cephalic version is an obstetric procedure that every obstetrician should know so as to ensure safe obstetric practice. Thank you.